So, your title and what you do it balances so many facets of human resources. And so that's genuinely complex. And I'd like to know, how do you balance all of the different priorities that you're faced with?
Yeah, I mean, it's a good question. I chose a career path that's very unique, right? So after law school, I articled and I decided very quickly that law firm life wasn't for me. So when I jumped into the HR side of things, I quickly learned that your biggest asset are your people, and it's also your biggest risk, therefore. So, in law, they teach you, how to mitigate and manage risk. And I think it only makes sense that you would apply the legal kind of frameworks to your people as well. But speaking about being coachable and taking feedback, I learned pretty quickly throughout my career that applying an overly legal lens to things and trying to fragment the different sections of my roles wasn't really working. It had to be really integrated. So I don't really, compartmentalize those areas. I more integrate them together. So kind of everything is just based on risk and, employee risk, and that comes down to employee experience, ultimately, right? Because if your people are happy and if they're staying and you're retaining them, then you don't have to spend all that money on, hiring and recruiting and retraining and all those things. So I would say that it's kind of an organic thing that's kind of happened over time, but there are still obviously moments where I'm finding myself being too legal, too black and white, and then other times where, I kind of get a little, risk, I guess, tolerant, too risk tolerant, maybe, for the sake of some more flexibility in the organization.
Yeah, it sounds like there's that intuitive approach to figuring out, okay, what part of me needs to show up to this situation.
Mm-hmm.
Excellent. And so there's also a lot of focus, as you would experience, on getting the legal side of accommodations right. And so we also need to consider the impact on employee engagement, because when people are seeking accommodations, they are in need or in situations where their dignity and humanity is vulnerable. So how do you balance that, and how do you also focus on that employee experience in that process?
Yeah, it's an evolving world. I would say, I've seen different models in different places that I've worked over my career. I've always been in healthcare, so it's always been within the hospital sector, but it's heavily unionized, so there's a lot of different competing factors that go with that. But I would say that, there's a tendency to want to make things very process-based, very rules-based, very consistent. And I know that a lot of our staff want that. They want clarity in what they do, and they want to know, if X happens, then I do Y. But what we've seen are that our employees experience it like that, which is not great. In the world of accommodations and disability case management, people want to be treated as people and not as a stat or not as, a problem that needs to be fixed. So, I think that there's definitely something lost when you try to overly formalize your processes and you try to make things too simplistic. So I think that it's important that, your philosophy has to begin with, what does the employee need, and how do we support them? And focus on, your majority of people. Your majority of people, by the way, want to work. They want to get better and they want to get back. And I think that it's just very easy for us to focus on the very, very small minority that might be, taking advantage of sick leave and trying not everything but work, So I think it shows up if you focus on the people who you feel are defrauding you. The people who are legitimately just trying to work are really going to miss out on that opportunity, and they're going to become very disengaged and, quite frankly, not really wanting to cooperate with the process.
Right.
And if you're unionized, like in my world, that's going to be extremely costly because every decision you make is going to end you up in arbitration, spending a whole lot in legal fees, fighting over something that you could have easily avoided from the beginning.
Absolutely. You mentioned, figuring out what the employees actually need. And I think this is where we introduce that undue hardship. How is it that we define that, right? And, balancing, figuring out what the undue hardship is versus that duty to accommodate. So what would be your advice or your approach to figuring that out and getting to the bottom of it?
Undue hardship is like a swear word in my world. Like, yeah, I feel like a lot of our leaders come from a very, very genuine good place when they say, I've reached undue hardship. I just can't possibly do it. And, a lot of them sound very, like they sell it, a lot of them, right? And sometimes, you know what, fair. Sometimes it is undue hardship. Very often, however, it's not. And, I think people confuse how convenient, like convenience factor with undue hardship, or they, use slippery slope arguments. And that comes from a real fear, I think, especially in the hospital world where your leader has like 150 staff under them. And they have real fear that how am I going to staff the night shift if I give Sally and Jemmy and Joe an accommodation to no nights? Everybody else is going to start talking about that, and now everyone's going to want no nights. So I understand that fear. It's real. But unfortunately, that's why we have to, take the approach of, if we do feel like we're starting to run down in numbers of staff that can work nights, for example, then we need to ask some more questions about why exactly you can't work nights. And is there somewhere else in the hospital where we can put you that don't require you to work nights? So, there are ways around this slippery slope kind of argument and mindset. But yeah, so at the end of the day, undue hardship, it's tricky. And it's different for every single employee. So I would just suggest that if you are struggling with this, that your programs really are focused on asking more questions. So just help me understand exactly what it is your need is and what it is your restriction is so that I can find you the best possible outcome. So your question shouldn't be, why can't I accommodate this? Or what are the issues with these requests? It should be, how do I make this work? Like, what is the possibility here? It's just two different ways of thinking about the same thing, but a lot of people just, freeze in legitimate fear sometimes. And I don't mean to disparage our people, but try to think creatively, think outside the box, What can you do?
Right.
And if that means you have to move some stuff around, then move some stuff around. And then, our employees just are that much more grateful for it at the end of the day. And they return to work a lot faster. And they heal a lot quicker, right? They get better. And you have less of these questions at the end of the day. So, it's win-win.
Absolutely.
Yeah.
Feeling that support through the process from your employer really contributes to that positive experience. And then, like you said, that return to work for sure.
Yeah.
Now, you mentioned asking better questions and asking more questions to figure out where is that line of undue hardship and what you can do. And so usually in cases of disability and needs for accommodation, sometimes the manager is the first point of contact. And so, in your position, some managers are good at handling those conversations and some aren't. So what would be your advice to managers, and what can, our folks here in HR as well, tell our managers and how to have these conversations?
I don't know if this is what you're all seeing in your workplaces, but I've noticed at least, I know it maybe because the baby boomers are retiring, but I'm seeing a lot of very, very young leaders, very, very green leaders. And, I think a lot of them are just terrified to go near these subjects with their people. So they are more apt to just ignore these very obvious signs that somebody is struggling because they don't want to say something that's going to get them in trouble or, land them, at the Human Rights Tribunal. I don't know, but the fear is real. So, what we have done at CHEO is we've made a point to make sure that we are educating as much as possible on this exact topic. So it's the human side of it, less the legal side. The legal side is important to understand the boundaries, but it's the human side. And it doesn't have to be like rocket science. It's like, hey, how are you today? Or, hey, like, I noticed like you haven't really been yourself lately. Or like, hey, like, you mentioned your child is sick. Like, how are they doing? Have things improved at home? Or like, can I help you with anything? Just very simple day-to-day questions go a long way. And I think a lot of them would be surprised at what they're going to get back from that. And those are also really crucial questions to have legally, too. And I hate to be the lawyer in the room, but like it is important, because if you don't have those if you don't ask those questions when it's a reasonable person ought to have known that person was struggling, right? That's actually a problem. Like that's actually part of the law. If you ought reasonably know, then and you ignore it, that's actually a breach of the code. So I don't like to scare people with too much legalese around that. I just like to encourage just ask questions, just be a normal person. So yeah, but I would just say check in, and then if your people start feeling like they're getting too deep, they're getting too much, or they definitely shouldn't be asking for diagnoses or actual medical situations. As soon as they feel like things are getting a little crossing that line, I tell them immediately refer them to your occupational health department, your disability case managers, the experts that know how to handle that from there. And then we like to refer people out to their treating physicians for additional information as needed.
Yeah, I think that's a great answer. I think keeping it light and having those normal, natural human conversations, but also listening, right? I think throughout this conference, we've talked a lot about employee listening, and sometimes we've talked about it in the lens of how do we collect data from our team, but sometimes the data is just in the day-to-day and figuring out how are you doing and recognizing, okay, it sounds like you're struggling, and can I help you? Can I connect you with the right resource? Can I connect you with the right place? So very interesting. And now, not to shift our conversation into technology, but we do have got to cover AI, of course. And so AI is showing up, and I wonder for you, are you seeing it in the accommodations process at all? Should it be there? Is it working well? Give us the intel on AI.
I mean, yeah, that is the buzz topic of the day, right? So I will say that, if any of you work in the healthcare sector, you will understand that we are dinosaurs in all aspects. So no, AI is not really a thing for us yet. But you know what? That's a good thing. And I go enough to these conferences enough to hear a lot about what different companies are offering these days, and thank God I'm learning through conferences, because I wouldn't be learning in my workplace. But I am seeing and hearing a lot of these really, really cool, innovative ways where AI is able to really take a lot of the guesswork out of this stuff. So accommodation. You think of it like a skills matrix AI idea. If you have that embedded in your Workday or whatever, I've seen Johnson & Johnson does something cool like that. Anyway, so AI could be used in your accommodation programs to help match people's limitations with available jobs. But this is all based on the idea and the presumption that your data is good to begin with. So you have to have a whole lot of data already in order for these tools to really work well. So, I mean, I've kind of did the opposite at the hospital, where I actually brought all of our disability management and accommodation programs in-house. We actually got rid of our vendor, which didn't go over very well with the team at first, but they're good now. But I wanted the team to be actually upskilled enough on the basics of what they do, and to start generating our own good data first before we start getting fancy with it, right? And so I think that that's like a general idea that I'm hearing a lot is that AI is great, but if you don't have the good data, it will spew out really bad outcomes, or it won't give you what you're actually looking for. So sometimes it's better to take the step back, get your basics right, sort that out, and then start thinking about how you can use it for mapping people's restrictions to available jobs that you have, your vacancies, or even be able to predict which vacancies are coming and knowing timelines, predictions for recovery times, things like that. So like AI can be useful in this world. But yeah, I would just suggest that you be ready internally for it before you start introducing it.
Yeah, that makes sense. And since you mentioned how you brought in that disability case management in-house, in that process, that's a big change management process. What were some of the learnings or the outcomes of that process?
Well, the reason why I did that, other than just to upskill my team, was largely the employee experience of having. So I'm trying to, empathize with our people who are disabled and who are out of work. You know, how it used to be was my team would stay with them, and we'd have a disability caseworker or an occ health nurse follow them along their short-term disability path, and then once they transitioned to long-term, they would go to the external provider. And then the external provider would be the ones helping their accommodation return to work program after. So I was like, that doesn't really make sense, because this poor person now has developed this relationship with another employee of the hospital who knows their ins and outs. They know every single time they call in, they know every little nuance of their condition, and what they can and cannot do and what they're accommodated to do. I'm like, and then all of a sudden they have to talk to a complete stranger who doesn't really care about them, only really cares about, the bottom dollar and these questions. It's essentially like an AI bot, right? And so these employees had to repeat their story every time, re-explain their condition every time. And if they're exhausted and they're recovering from something, that's the last thing they want to do. They don't want to be bothered by their employer while they're trying to get better at home and recover. So it didn't seem right to me to be splicing that and dicing that process. I thought it made far more sense for our people to stay with them on the journey, and also understand how we can best accommodate, Jimmy. We know Jimmy's story. We've known it since the beginning, and we still know it. And this is how far he's come, and this is what we know works for him and what doesn't work for him. And so I found that it was just really inefficient to start breaking that up with an external provider.
Absolutely. Earlier today, we heard there was an example shared about how AI was empowering patient experience, but from the lens of the doctor or the nurse was using it just to take the notes so they could focus on that human interaction. And so it sounds like throughout this process, that human connection between, that point of contact and having that continue throughout the whole process is really important. I think we've all had that frustrating experience of having to retell our symptoms over and over to someone who just quickly skimmed over the notes. And so for you to recognize that in that employee experience, I think that was a really great opportunity that you've taken advantage of and changed and shifted to improve that. So thank you for that. And a couple more questions. In the duty to accommodate, and as we're trying to accommodate employees, as we're working with disabilities, sometimes there could be some bias, right? Sometimes there's some assumptions into what they can and cannot do. And so what is your, even from that legal lens, what is your advice to managing and mitigating that bias and trying to remove that from the process?
Yeah, this is definitely a world in which it is very, very sensitive information that you're dealing with every day. And so that's why I would caution the use of AI, at least if your data is not stellar. Because every little decision that you make in this world with this type of personal health information, a lot of it, or just, personal information, period, you do risk a lot of those assumptions that would get missed. So if you're going to use AI to start doing predictive modeling and things like that and to help you out, I would just really recommend that there's a really strong governance structure over what the outcomes are and what the recommendations are. So some of the bias that you'll see is like, certain demographics of your employees, maybe have higher sick leave usage than others, and that could feed into your data and how your AI is telling you that you need to, treat one group differently than another, and you might not even notice it. Like it can be very subtle, and so you wouldn't want just like, your new grad nurse that's just starting in Occ relying on that and not knowing any better, for example. Like you can see how quickly this could happen. And then your unions would be on top of that too. Like I know our unions are anti-AI, but again, because we're in the hospital, we don't have it yet, so it's fine. But like they're anti, like they don't want anything to do with AI. And so they are going to fight us on any of this for a lot of these reasons, because they don't want their people to become statistics that, compound these internal, very subtle biases in our data. So yeah, it's tricky, but as long as you have really good governance and oversight of it, but it starts with your data.
Absolutely, absolutely. Now, my final question is more around some advice. If you were advising an HR leader who is building or rebuilding their accommodation program, what would you tell them?
So I would say, because I've done this in the last couple of years, last 3 years, I would say that you have to really understand your corporate culture first, and you start with the philosophy first before you start to talk about process. And I'll share. I learned this the hard way a little bit. I was fresh at CHEO. I had just come from, I won't say the name of the other hospital I came from, for 10 years. And so I had prepared my briefing note for the executive team on, my thoughts on this, on like, basically tearing apart this whole program and redoing it. And I had come with all of my business rationale. So my bottom line, financial, this is how we're going to save our money. This is where we're going to cut costs. And, these are my projected savings. And I remember just sitting there ready to go. And I wasn't even through like maybe my first or second points. And I got caught off right away with a million questions, and they were all about the employee experience. And nobody wanted to hear about any of the financial stuff I had prepared. And I immediately just went silent. I was caught off guard, and I was like, I'm not in Kansas anymore. Like this is not my world that I know, but I also love it. And they were asking all these really, really good questions. Like, well, what does this mean for the employee? How are they going to experience that? Like, are they going to know what to do and where to go and who's going to help them? And I was like, this is great. So I just closed my notes, put them aside, and I was like, I'll just speak to you normally, like a human. And I was like, yes, actually, that is the whole point of this. I just put together all of the other financial wins that are kind of more just, about less turnover, which is really employee experience and engagement, right? So it's 6 one, half dozen the other, but they didn't care about the money. So my point is philosophy is so important. So if your philosophy is, I want employees to have the best experience with their return to work process or their accommodation process. I want them to feel supported at work. I want them to feel like they have every resource that they need to do their job effectively, so that they can ultimately care for our patients, which in my case are little kids. So, it matters. And so then after that's established, then you start talking process. So you need clarity. You need to know who's doing what. Who's on point? Who are my people? What is our goal? And so, teaching the whole purpose behind the plan is essential. And then after that, it's actually capability. It's getting people trained properly. So like training those managers on how to have those conversations with their staff. How are you today? You don't look like, like you seem off, or like, is everything okay? Train them. Also train them on who to go to when they have questions. Train them to help their staff on how to access the resources that are available to them. If you have EFAP or Occ Health or whatever, make sure they know that. And then it's collaboration. So making sure that all of your different teams, so like so a legal and an HR and Occ Health and a labor relations and your talent acquisition, everybody who needs to know and be on board is on board, and they all know their roles and their responsibilities, so that it's seamless. Otherwise, the employee is going to feel like they're being bounced around and no one's talking to the other person, and then they have to repeat their story to 15 million people, and no one wants to do that. So that was important. And then lastly, I would say know what your measurements are, or what you want to measure. Because measuring sick leave hours is not really great. I mean, it's great for benchmarking over time with like the province or whoever you benchmark with, in order to assess whether you're being successful kind of internally. But I wouldn't use that externally focused. I would look more on like your engagement scores, like how supported do your people feel, your turnover rates. Are your people staying? Are you retaining? And the other kind of measures of like health and wellness, as opposed to, what would seem like the obvious, how quickly can I return someone to work? Or, how many sick hours have I spent? So, that's
great advice.
In a nutshell.
No, I think that's great. You gave us that 3-step process, so thank you. We've got just a little bit of time for questions for Gillian while she's here. So for those of you where accommodation and disability management is a bit of a challenge, if there are any questions, we'd welcome that. Okay, we've got a few.
All right, so I'm based out of Quebec, or most of my team is based out of Quebec, where a medical note nowadays has no information on it. And we have issues of employees going on leave. We can't qualify for STD because we're too small a group. They come back to work because they get their doctor to write them a return to work note. They won't tell us why. They won't come to us with any accommodations. 6 months later, they're gone again. So how do you kind of create an environment where employees are comfortable coming to you for those accommodations before they need them, before they're on leave?
Oh, that's a great question, and I think a lot of workplaces struggle with that. The way that I like to approach it is understanding how to best support your employees to be healthy and safe at work. So if you're feeling like you're not feeling secure that they might be healthy and safe in the workplace because you don't know what the issue is, especially if they were off quite a while, then you're entirely within your rights to ask these questions to their treating physician. You get their consent, of course, and say, like, we just want to make sure that you're well. And for your own safety and for the safety of your peers and whatever you do for an industry. But we just need to ensure that. So before you come back, before your actual return to work date, we would just love you to consent to these follow-up questions with your treating physician.
The problem is, like, much like the rest of Canada, we don't have family doctors. So they're going to single clinics, they're getting single notes, they're getting single letters. We just had a case where we'd worked with our lawyer to send someone with a list of questions to answer, and we barely got anything back that was usable. So like, it's really kind of getting them to come forward, tell us what they need, that we struggle with, more than at this point trying to go and get that data ourselves.
Yeah, and sometimes, I mean, the struggle is real. Sometimes if it's really like concerning, you could look into an IME and have them, and those take forever to schedule, but it's an option. But yeah, and then the other idea is to just make sure that you document that you've offered all the accommodations. So if they keep turning down accommodations, if they keep saying they're fine, let's say performance is poor or their attendance remains really poor, over time, you can actually look to like, you know, maybe this isn't the right job for you. Maybe you need to look at maybe a frustration of contract type of scenario if it's still not working. But the point is you got to kind of keep trying. You got to kind of keep asking and going through those steps to make sure that you're supporting them as much as possible.
Thank you.
And we'll take our last question in the corner, I think. Oh, thank you.
I have to reiterate again from yesterday, we cannot condone running in a space where there are so many trip fall hazards. So thank you, and I'll try to be brief with this. I know I've mentioned a few times that our business is rapidly expanding. We're already at 8,000 strong. We're looking to double our population by 2030. And coming into my role as a disability and accommodation manager a few years ago, one of the first things I did was outsource accommodations and leave management, because it is simply not feasible to do it and to do it well, to do it at all, yet alone to do it well with a very small HR team. Some of the challenges that we have are trying to put some of those responsibilities back into the hands of frontline managers. When our managers are geographically dispersed, maybe they were a high seller and that's why they were promoted into a people leader. And as we know, high sellers don't always make the best people leaders. So what I'm getting at is how can we ensure that managers are towing the line appropriately? We've attempted to do training, and we still have managers that will be like, "Hey, tell me all about your medications and what they're for." And it gets back to me, and I'm like, "But why? Why would you ask that question?" So all the training in the world cannot protect us, and all I hear is risk, risk, risk when I hear put it back into the hands of managers. So what do you think is the appropriate balance between what a manager should or shouldn't do versus what needs to be outsourced or handled professionally within the HR team?
Yeah, no, that's a valid question. I also struggle with trying to upskill the management team as well, because like you, our human resources are minimal, and the HR team, I mean. I would say that anything that's encroaching on any kind of medical discussions, so even medical notes, ideally would not go to leaders. Any sort of diagnosis information, I mean, you can tell them that. Like, you can say, like, absolutely no discussion of diagnoses, of medications, anything like that. And I would say that that's where the line is. You can ask somebody how they're feeling and how they're doing, how are things, but like beyond that, once you start crossing into the medical world, and even saying like, are you feeling anxious today? I've even seen some people like suggest that that's probably too sensitive nowadays. Like, it's gotten very sensitive in that world. So I would say that at that point, when it starts becoming a medical issue, you send them to the disability caseworkers.
Excellent. Thank you so much, Gillian, for your perspective, for balancing our legal responsibility with, our intention to deliver a positive employee experience. So you have such a unique perspective on that. So I can't thank you enough for closing out our conference today and sharing your insights. I really appreciate it. Thank you.
Thank you.